this is the last project I wanted to tell you about, and it was a project I did with another nurse, so obviously you can see I love working with nurses. And we wanted to look at physical activity and nutrition with youth in an area of Madison that, again, has a lot of disparity, but disparity but that butts up to great wealth. And so there's just a huge juxtaposition between the people that are experiencing poverty and extreme poverty with those that aren't. And our aim was to explore experiences of health and place in these 4 main areas: nutrition, physical activity, feelings of being welcome, and safety. And this is the map of the area. And what's very interesting about satellite photography is this is where the community center is that we worked with, but it wasn't there when this picture was taken. So if I zoomed in on this, there's a lot of activity around there, but the community center actually isn't in this satellite image. And so again, hoops. So what we found was that there is a lot of opportunity for youth to be physically active in this community, and they are physically active in this community. And yet there are places where they can go where they aren't welcome. This is a restaurant across the street from the school where they're gonna, if they go here, they're not treated very well at all. And when if right down here is a big mall. It's there's 2 big malls in Madison, West and East. Madison is split by lakes into the west side and the east side. And this is the big West Side Mall. And when the kids went in there, what I really wanted them to do was map welcoming spaces and places where they weren't welcome. Well, they took pictures of 2 stores. One was a sporting goods store where they say, if I go in there, I get followed. The other store was the Apple store, where they say I could spend 2 hours in there and I could play video games for 2 hours and they're going to be nice to me the entire time. And so they knew where to go and they knew where they were welcome, and it made a difference with how they spent their time. They're going to spend 2 hours in the Apple store, but they're going to get as fast as they can out of the sporting goods store. And so we're reaching the tail end of this part of the presentation, but this is a really, really important part of the presentation, and it's one of the steps in participatory photo mapping, and that's translation and information exchange. That you come up with this new knowledge, and who are the people that you're going to be presenting this to, and to be thinking strategically and comprehensively about the people and the stakeholders that are going to be able to use your information. It's diverse audiences. A lot of the translation comes from engaging people like you and learning about participatory photo mapping, and also doing some consulting work. I've done some work in New Hampshire where we did an entire project on physical activity in rural population with elderly, and learning how elderly people, why they aren't being physically active in their community when it's extremely rich for opportunity. We're learning how to think of maps differently using Google Maps, GIS, and trying to figure out how to make it easy. Because when you're working with community groups, it's not very easy to say, okay, the first thing you do is you need to get ArcGIS, and then you need to go and buy the map, and then you load it up this way, this shapefile, and it's just very techy, and it's not easy for a lot of community people to use, especially if people don't have computers, which sometimes they don't. And this is an extremely great method for building partnerships between people at the university with people in the community. And my personal philosophy is that we can't do it all on our own, that we need to be building not only partnerships, but interdisciplinary and transdisciplinary and multidisciplinary partnerships. And that as soon as you start getting people from different sectors working together, you are going to start to be able to approach the problem more comprehensively. And like Dave was saying, incorporating this idea of social networks and social network analysis, that building ways for people to come together is going to be health protective. And so a lot of times communities are devastated enough that they don't have the community togetherness that they need to kind of mobilize around issues, but that this could be a tool for actually building that first step in getting communities to come together. And then right now we got a grant. We're doing an evaluation of this method. We're making improvements on this method, and hopefully increasing the evidence base for this method as a method and an intervention, which is something that we've been exploring. This is an example of translation. I don't want you to read this slide. I just want use it to make a point. So we did one project where we did the PPM with the kids. They identified safety and not safe areas. We analyzed the data based on what they had told us. We came up with a document of exact changes that needed to be made. Reduce speeding on Cypress, improve the crossing on Cypress, and these crosswalks. And here's the agency responsible for making this change: Traffic and Engineering, the Madison Police Department, Public Health, a Madison Metro with addressing issues of safety around the bus transfer point. And so we go to each of these organizations and spend a lot of time in meetings trying to make decisions and trying to figure out even who, there was one point where Madison is very confusing because we have the town of Madison and the city of Madison, and there's like a little pocket. The liquor store I showed you is in the town of Madison, which means that the city of Madison police have no jurisdiction over that. And so it's really complicated, but I've been in meetings where people had to figure out who has jurisdiction over this area. And here's another way that you can translate information, and that's by having young people and the participants giving the information out to the audience themselves. And I have to say that when kids give a presentation, people listen. And in the United States, this is one shortcoming that we have, and that is that we haven't incorporated youth voice into decision making. And here's an example of an outcome. Here's a family walking. This is called a line of desire, which means this is where people are going to go whether or not they're supposed to. And this actually was the city was going to do this anyway, but when they heard from the kids and they heard from the PPM project, they decided that they were going to do it quicker, so it can help leverage your work.